It seems like a lot of people's birth preparation just sort of turns off once the baby's out, but today I want to talk about those crazy minutes right after baby is born, what you can expect, and 5 things that happen to baby right after birth. Honestly, I think this ends up in a fog for a lot of people, so it honestly might be news to some of you who've even had a baby because it is such a precious, busy, crazy time. So I'm glad that you're here watching this. And I think a lot of people don't even prepare for their postpartum life. So I actually have a postpartum plan where you can think about what you want to have happen after baby is born. I'm going to put the link down below. Okay, so baby has been delivered. Of course, the nurse hits the timer so she knows what time the baby has been born, and that starts delayed cord clamping. Now, the standard of care for the delayed cord clamping in the United States is 30 to 60 seconds. Studies have shown that that is long enough for baby to get the nutrients that they need from the placenta. Now, some of you might want your provider to wait later. Talk with your provider because that is not usually something that they normally do. And sometimes they get in a routine of things. As you can imagine, you have a routine of things. So if you want the doctor to wait longer than 60 seconds, that's something you'll want to bring up at a prenatal appointments and have someone who can remind them that after delivery. As a nurse, I actually like to put up signs about that in the room to remind me and the provider a patient would like to wait 2 minutes before clamping the cord. Now, one thing that I don't hear brought up enough is that everybody has a different length of cord. Now, yours is hopefully longer than this one, but you got to remember the placenta is still up inside your uterus. And so when they go to put baby on your chest, sometimes baby can only come up to right here until they clamp the cord. And it is really hard to see your baby at your belly button and to love them and all the moments that you wish that you had. So while a lot of people want that 2 minutes of delayed cord clamping, it can be difficult because baby's just in an awkward place down here. In fact, sometimes providers just have to hold on to the baby themselves because they can't really put baby on you because it's so low. Again, everybody's cord length is different, and some people, the cord can stretch all the way up to the chest. You don't know until the baby comes out. But again, 30 to 60 seconds have been shown to be enough time for the baby to get the nutrients from the placenta that they need. If you're like, Hillary, I have no idea what you're talking about. The idea is that there is blood inside this placenta that could go into baby to give them extra blood so that they aren't anemic after birth. And hopefully that non-anemia continues to hold as baby is growing and thriving outside the womb. And so when we don't cut off the cord, we allow that blood to flow to baby and baby gets the nutrients. If you have any questions about it, talk with your provider at your next appointment about it. Now, even when we're doing delayed cord clamping, we are still drying off the baby. Now, labor and delivery nurses and NICU nurses are trained in something called NRP, called neonatal resuscitation. But we are the ones in the room trained to help baby transition to regular life. 90% of babies don't need much help in order to transition to breathing in the air, which is absolutely amazing considering just minutes before they were living and breathing fluid inside the uterus. But one of the things that we need to do is dry baby off because if they are wet, they lose their temperature very quickly. And so we want to dry them off and keep them warm. This is one of the reasons why we try and keep baby close to your skin. And again, you'll see the nurse drying baby off and then removing the wet towels and putting on dry towels to keep baby warm. This can happen before we clamp the cord. It can happen after we clamp the cord. Your nurse will be making sure that baby is staying nice and warm. As a note, at most deliveries, as long as everything's working right, there should be one nurse for you and one nurse for the baby. So there will be a baby nurse and a you nurse, although usually most of us do both things. So you can always ask either nurse if you have any questions about you or the baby. Now, once baby's out, cord's clamped and we've got baby up on your chest, your baby nurse is going to do a quick assessment of baby. These are called the APGAR scores, but in addition to that, she's just going to be seeing how baby is transitioning. If you're interested in a video about the APGAR scores, tell us down below, but it's not like the ACT. I think of the APGAR score as just an easy way for us to communicate to each other how baby transitioned to the air-breathing world. It includes things like their color, how they're breathing, their tone. We want to see baby kind of collapsed in, not just like laying like this. And so that's just an easy way for us to communicate with each other about how baby's doing. Fun fact, if you have an OBGYN, they are not NRP trained. And in fact, when I've had things go really bad with a baby, I actually have the OBGYN go out in the hallway and scream for help because they are not trained to help with baby after delivery. Kind of crazy, right? The next thing, baby just hangs out with you. We call that the golden hour. Now, this isn't always the case. If baby is having any issues transitioning, a lot of times we'll put baby in a warmer, or sometimes they need to go to the NICU. By the way, if you're interested in a video on baby going to the NICU, tell me down below. I think that might be interesting because I think a lot of people are caught off guard that baby could end up needing to go to the NICU, but most often baby stays in the room with you. We try and keep you skin to skin. Now, I know a lot of you are going to think we need to breastfeed right away, right? Because you're wanting to establish a great breastfeeding pattern, but baby is a little bit dazed and confused, and likely you're a little bit dazed and confused. As I said before, this is a wonderful, lots going on time. So I think it's best to just love baby, to look at baby, to let baby, be on your chest, to be by your nipples so that it tells your body to turn on your milk. Baby is not going to suck on your breast like Maggie Simpson at a bottle right at this point in time. I'm a huge fan of skin to skin. If you are just feeling too crazy, you can actually have your partner do skin to skin. They shouldn't feel weird about it. In fact, I love it when a partner wears a button down shirt so they can just unbutton a few buttons and we can put baby on their skin as well. I hear a lot of people saying so much was going on at this time because you got to remember, stuff's going on with you. Your provider might be down there sewing you up. You might be losing a lot of blood. Things can be happening to you at the same period of time. So if it's just too much to have baby on your chest, don't hesitate to say, hey, can my partner hold the baby? Hey, can the baby go in the warmer? Again, there is a nurse, or there should be a nurse that's specifically assigned for the baby, so they can always watch baby for you. Don't feel like you have to do everything when you're feeling overwhelmed with baby on your chest. I know for me, my second baby came out covered in poop. It was everywhere. And so I actually asked the nurse to run him over to the warmer and just wipe him down because there was so much poop. I couldn't. So it was nice to have them clean him off. Fun fact, when you have baby here, it actually helps baby stabilize their breathing as they're hearing your heart because that's something that they heard inside the womb. And it actually helps you stabilize a little bit. Sometimes people after delivery get something called the shakes, where you just shake a little bit, kind of if you were cold, but these people aren't really cold. We don't exactly know why it happens, but a lot of times when we put baby on your chest, the shaking stops because your little warmer is right there on your chest and you just feel so safe and cozy. Now, the last thing the nurse is going to be doing is a set of vital signs on the baby. So they're going to be taking baby's temperature, usually under their armpit. They're going to listen to their breathing and they're going to listen to their heart. It's really important that we do that. That's actually part of the APGAR scoring. And we want to know that baby's lungs sound clear, that they don't sound full of fluid. And we want to know what their heartbeat is, because if the heartbeat drops too low, that could show that baby's having problems. Again, with the temperature, we want to make sure that baby is stabilizing their temperature, and we're actually going to take the temperature and all of those vital signs several times as you recover in the labor and delivery room. Now, in some hospitals, you recover in the same room that you had your baby. And so you have your baby in one room and you stay in that room until you go home. But at most hospitals, I find that you then transition to a postpartum room. Honestly, I think it's better because those rooms in labor and delivery get really dirty, and it's really nice to transfer my patient to a nice clean room with a better bed. You'll find that the beds in postpartum are better because they don't have to come apart to have a baby on them. Now, you might be thinking that nurse has to take the baby over to the warmer to do vital signs, and that is not the case at all. We can easily do vital signs on you. But if we find that anything's wrong or we just need a better look, a lot of times they'll ask to take baby over to the warmer just to look at them a little bit better, get a better feel of how things are going. Your nurse will also be doing a very quick assessment on the baby, checking fingers and toes, making sure that all the parts are there and everything looks good. They'll do a more full assessment once that golden hour is up, but they want to just make sure that things look like they're functioning right, all the skin is closed, things like that, really quickly right after birth. Now, there's a lot of things coming up on this baby's future. It can be immunizations, a vitamin K shot, erythromycin ointment for the eyes. Some places do the bath very quickly, although I'm a huge fan of delaying the bath for 24 hours. Although in some cases, the baby does need to be bathed right away. Sometimes the baby's going to need blood sugars, especially if you were diabetic. You're going to feed the baby, breastfeeding, or bottle feeding if you've just decided to bottle feed from the start. They're going to put a diaper on baby. They're going to swaddle baby up. So lots of things are in this baby's future, but I think it's important to know those first things that happen right after baby comes out so you're not caught off guard by any of them. What other questions do you have about baby coming out? Tell me down below. Like I said before, I think a lot of places just shut off all information once baby's out. They're like, "Ooh, baby's out, great." But I think it's really important to know how to manage that postpartum stay in the hospital, what to expect of both you and baby in the hospital. The online prenatal class for couples has a whole chapter on your postpartum stay at the hospital, which I think is wildly ignored by the rest of the obstetrics community. And getting the most out of that stay can be a huge win for you. I'll put the link link for it down below. Now, I would encourage you guys to think more about what your postpartum life is going to look like. I have a whole video about it. I'm going to link it right here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and postpartum life.